Hi again, caregivers of children, parents, and grandparents. I'm here again to give a little bit of bad news after quite some many months. Today I saw one of the first case in a while of hand, foot, mouth disease, as it's called, which is a viral infection of the skin, passed very easily among small children at school and daycare. So once I've seen one case, there might be a lot more, at least in this community and maybe in other places. So if your child has bumps around his hands and mouth and on the feet, that's probably what it is. Fortunately, it's not really a disease like we think of diseases that's going to cause harm or require long-term treatment. In fact, it goes away by itself in a matter of weeks, but it is quite contagious until it's gone and can spread more and more and look kind of concerning looking, but fortunately it isn't. The itching is kind of medium as far as different things that cause itching. If your child is itching or scratching, then you can try to reduce that with taking an antihistamine like Zyrtec or the generic version of that. If it's kind of dry and rough and itchy in certain places, you can apply a moisturizing cream to those areas, maybe some hydrocortisone cream. Just have to be careful not to overdo that. And try to keep your child from scratching heavily or digging into their skin, including by clipping and filing down their nails and little reminders. So hopefully this will turn out to be a false alarm, but experience tells me there could start to be an epidemic of hand, foot, mouth disease at school. It is contagious until it's gone, so that could be a reason not to send them back to school. It can get to be so pervasive and long-lasting that some schools and daycares just allow it, as many of them do, allow colds to happen and not keep out everybody that has that until they don't have any contagiousness anymore. But that's really up to each school to decide or school system to decide how they want to handle it. All right, well, be careful out there. It's spread through touch. And if you see those little bumps coming up on hands and feet and maybe around the mouth, you'll have an idea what's going on.